This is Rob Horowitz. I'm the host of our periodic webinar sessions on all aspects of the opioid epidemic, but with an emphasis on prevention for the Council to Prevent Opioid Dependence. We are very pleased today to feature Melissa Pilk, who is a clinical psychologist and also an assistant professor at Brown, who has conducted groundbreaking research and is an expert on pain and how to treat it effectively and safely for young adults and adolescents. And we're going to begin with a presentation from Melissa, and then do our usual question and answer for her afterwards. If you do have a question and you wanted to ask, just place it in the chat and we will get to it. So Melissa, let me turn the floor over. With no further ado, let me turn the floor over to you.
Awesome. Thank you so much, Rob. I'll just get my slides up here. Can you see that okay?
Yes, the slide looks
great. Okay, awesome. Yeah, thank you so much for the opportunity to present to you all and chat with you all today. I'm excited to talk with you about some of the work I've been doing, working to build an intervention for youth that are undergoing wisdom tooth extraction that targets both pain coping and substance use during this clinical encounter. I have no conflicts of interest to disclose, and this work is funded by NIH. Just a little bit of background too about some of the work that I do as a pediatric pain psychologist and researcher. A good amount of the focus of my work is on developing interventions and programs to help youth and families access evidence-based pain and substance use treatment. Some of this is in the context of oral surgery, but also managing pain and substance use among youth with chronic pain. The other space that I work in is trying to improve opioid use disorder treatment for youth by identifying barriers and things that get in the way of family involvement and caregiver involvement in the context of that care. Just in the next few minutes, I'll be talking with you two kind of objectives. Is first just a quick overview of trends in substance use in youth, just to kind of set the stage for this work. And then I'll dive into sharing some of the feedback we got from youth and family members in the context of our program development. And so probably not a surprise to any folks in the room here, but what we know about substance use in adolescents and young adults, it's fairly common. By the end of high school, about 1 in 3 youth report using substances. Most commonly used substances are alcohol, cannabis, and nicotine. And substance use in youth is dangerous and costly both to youth, their families, and to society. Importantly, adolescence is a peak period for initiation of substance use. In these graphics here, broken down by substance, you'll see in the bottom age at first use. And there's this huge jump upward around age 15 in rates of use between those below 15 and then above. And what stands out to me in this data is that there's a really critical period for us to intervene and for us to try and change kind of the trajectory for young people. Looking at some more recent trends, it is promising that overall rates of substance use among youth have been trending downward in the last few years. But unfortunately, the other reality is that rates of overdose-related deaths in youth and in adolescents specifically continue to trend upward. And so what the takeaway from that for me is that youth substance use is getting more risky and consequences are becoming more harmful. When we're looking at the opioid crisis and specifically how it impacts teens, about 1 to 2% of adolescents report using opioids in a way differently than prescribed, also referred to as opioid misuse. And leftover prescription opioids, whether from their own prescription or that from a family member or friend, remain a primary source. Only about 1% of adolescents meet criteria for opioid use disorder, and a very small percent, about 1%, reports fentanyl abuse. And so while substance use in adolescence is developmentally normative during a time period where you're exploring taking more risks, What's really important to also note is that substance use during adolescence is not without risk. And the majority, something unique to adolescents in particular, is that most consequences associated with substance use are more so related to the fact that substance use confers risk and not necessarily addiction in and of itself. And this is particularly true in the context of opioid use and opioid misuse. That some of the negative consequences of overdose and overdose related deaths are more so because opioid use is risky and less so that they meet full criteria for an opioid use disorder. The other thing that weighs heavy on my heart and drives a lot of the work that I do in this space is that the reality is that about less than 1 in 10 youth that need substance use treatment or who would benefit from substance use treatment actually access and receive treatment. And so that was definitely a driver for the work I'll be presenting to you today, is just thinking about what are other opportunities and other times where youth are engaged in treatment and care that we could try and intervene and try and address substance use because we know it's challenging to engage and retain youth in treatment. So moving into the work I'll be presenting to you today, this is on some program development specifically targeting youth that are using substances and undergoing wisdom tooth extraction. And so what's really interesting about wisdom tooth extraction, it's one of the most common painful surgical procedures that adolescents and young adults undergo, regardless of pre-existing medical, mental health conditions. A lot of youth go through and get their wisdom teeth out. About 1 in 3 youth who are getting wisdom tooth extraction surgery report pain or swelling before surgery. And then about 1 in 4, and this has been trending downward, which is promising, about 1 in 4 receive their first opioid prescription after wisdom tooth extraction surgery. And about 15 to 20% of youth report postoperative complications, whether it's infection, issues with stitches, things like that. And what we do know is that youth that use substances are at higher risk for postoperative complications after surgery. And so, I'm biased as a pediatric pain psychologist, but I think pain management matters quite a lot. And I think that pain management is really an important conversation and component of prevention for youth substance use. There's some compelling data that pain relief is one of the most commonly identified motives for non-medical opioid use in adolescents and young adults. And there's this negative kind of reciprocal relationship between substance use and pain and using substances to cope with pain. And we have other strategies that are way safer and more effective than using substances to manage pain. And we need to get those treatments in the hands of youth. So this is a 5-year study that the first phase, which I'll be sharing with you today, was working to get feedback from youth and their parents to shape the content and the format of the program. And then the second and third phase are rolling it out in a clinical trial to kind of evaluate the impact and also the feasibility. And, the reason why we started off with this formative work of hearing from teens and hearing from parents is that we know that engaging end users, engaging patients in the intervention development process is linked to higher acceptability, engagement, and outcomes in treatment. And I think this is really important in the context of youth substance use treatment when engagement and retention rates are so low. And so, part of my goal is I don't want to develop a program that teens don't want to use or that they don't think is relevant for them. We conducted qualitative interviews over Zoom, and these were audio recorded and transcribed. Talked about a lot of different things in the interview, understanding more about their experiences with oral surgery, their thoughts and worries about oral surgery, how did they manage pain, what recommendations did they receive from their provider, what strategies did they actually use. And then we shared with them an outline for our program and asked a lot of questions, really wanting their critical feedback about that program content. We recruited teens between the ages of 15 and 20 who reported past year substance use. And we recruited teens both who were scheduled to undergo oral surgery and already had surgery. Just we were curious about if there might be differences with their expectations before and after surgery. And then we also did interviews with parents as well, since parent and family involvement is kind of the gold standard of care for youth substance use treatment. We, in regards to our sample, we spoke with 30 teens. About 70% of the sample identified as female, 30% as male, and half of the teens were pre-surgery and half were post-surgery. And in regards to their substance use behaviors, about a third of our sample reported high-risk substance use on the CRAFT screener, which is indicative they may or more likely to meet criteria for a substance use disorder. And about half the sample reported low risk substance use. Most commonly used substances were alcohol, cannabis, and nicotine, which is on par with trends. And then I won't talk as much about our feedback from parents today, but we did speak with 21 parents, majority identified as female. And so during the interviews, this is the handout that we shared with them. And this is an outline for what we had thought we would do for our session. We proposed doing a 75 to 90-minute session with teens and a 60-minute session with parents, and then bringing them together for about 15 minutes to chat at the end. And the content for our session was pulled from evidence-based strategies for brief substance use, like motivational enhancement therapy, and then CBT for pain coping, some of those strategies that are used for acute pain settings. And then also pulling in education and information about safe storage and disposal of opioids. And we figured whether or not they get an opioid prescription, it's an opportunity for them to just get this information and to understand about risks associated with opioids. So we asked teens what content what content seemed the most helpful and the most relevant for them. And overwhelmingly, teens reported that learning about medication and non-medication pain management strategies was the most helpful area. Interestingly, teens asked for data on the effectiveness of non-medication strategies. They wanted more like numbers and information about, deep breathing, distraction, things like that. We got some clarifying questions if we were recommending cannabis as a non-medication strategy, which we're most definitely not. And so something that we need to be very clear about within our program. And teens also talked a lot about like they wanted skills and strategies to be in a good mindset, to kind of manage worries, manage anxiety before surgery, because it's the first time they had, for many of them, first time they'd had any kind of procedure like this. This is just a quote from one of our teens. I think learning about medication and non-medication strategies, I think that's also really important. Again, I think the mental health aspect of tough things that deal with pain and hardship, I think the mental health aspect is another big part that's pretty greatly overlooked. I think a lot of this program, to me, the appeal, if I were to decide to go, is to get educated on a lot of things that are overlooked and not touched on by doctors. Secondly, teens were really interested in learning more information about opioids, and in regards to ways to minimize risk and how to use them safely. And what I want to highlight here too is that the majority of teens we spoke to expressed fear about prescription opioids, did not plan to fill their prescription if they got one. And really didn't have interest in using prescription opioids as part of their pain management plan. And this was largely, they cited examples of family members, friends, people, and information, in the media about the opioid crisis. And I think that's important to highlight. This is a sample of teens that use substances who were like, no, like that's, I'm pretty nervous about that. Actually, teens were more nervous about it than parents, which was interesting. And then lastly, in the context of talking about substance use in this setting, teens were clear, like, they didn't really want to make long-term goals, but short-term, they were like, tell me how using substances before and after surgery will impact my healing. Tell me, is there a certain amount of time or days that I should not drink or not smoke? And I think that's interesting to know. And we also could potentially use that, to build some momentum. You plant some seeds for changing substance use in the short term and give them skills to make longer-term changes. A few other things, the feedback overwhelmingly was that a 75-minute to 90-minute session was not feasible. They wanted the information in as short and concise a format as possible, like 30 to 45 minutes max. Teens did not like the term intervention, so I still slip sometimes in trying to refer to it as a program. And another important thing is a lot of teens were hesitant about their parents being involved. And they suggested, is there a way to make the parent session optional? Because for me, I wouldn't participate if my parent had to be involved. And I'll share in a few moments kind of how we've incorporated that feedback. And then importantly, in the context, this is always important in the context of talking with youth about substances, they just emphasize like, we don't want to be judged. We don't want to have a finger wagged at us. Like, we know this isn't really the best thing to be doing. And if that's the goal of this, then we don't want anything to do with it. And just quickly, parents also noted that the content they thought would be most helpful is learning about medication, non-medication pain management strategies. And parents also were interested about how to assess their teens' pain and pain management needs. Like, how do they know when to give them more medication? What are the best questions? What are the best ways to ask and to know what their teens need? Because some parents noted we haven't ever had a situation like this before, and so I don't really know how to tell when they're in pain. This is a quote from one parent. No one wants their kid to be in pain, but at the same time, you need to understand the risks of just throwing medicine at them. So acknowledging that there are other ways to help. This might be the first time someone has any kind of surgical intervention, and to maximize it in terms of the positive experience and the communication between patient and the treating provider is really important. Um, as I wrap up here, some of the implications for our program development is we really kind of flip things on its head and have worked to build a program that is online, self-guided, and virtual. It was really kind of the only way that we could get in all of the content in a 30 to 40-minute time frame. We've now restructured the clinical trial where parent participation is optional, but encouraged whenever possible, because we figured we don't want to lose teens because of the parent involvement piece. So let's capitalize if teens are willing to be engaged. And then one of the things we've shifted is we've expanded our inclusion criteria, and we've expanded the content to be relevant for teens that use substances and teens that don't use substances. That way, if a teen enrolls in our trial, it doesn't inadvertently disclose to their parent that they are using substances. And it also gives us an opportunity to see how do teens that don't use substances, receive the pain management skills, and they'll get education about opioids as well. This is the overview of our program that we have built online. We start out focusing on kind of science-based pain management strategies, because teens were like, do not talk about substance use right out the gate. Like, talk about pain first and then fold in the substance use content. Module 2 has some education about opioids. Module 3 focuses more on substance use in that perioperative time. And then we wrap up by having them make a plan and highlighting what are some medication, non-medication pain management strategies you want to use. How will you communicate to your caregiver or parent if you need more support with managing your pain? What are your goals for pre and post substance use? Things like that. So a couple of key takeaways is that I was encouraged by is that teens and parents were generally enthusiastic and receptive to the content. The information teens received from providers about pain management for their surgery was really kind of varied. And especially those who didn't get a lot of guidance or a lot of information wanted more. And we have worked to incorporate this input into the program that we've developed, and we'll be piloting in our clinical trial. This is just an overview of our clinical trial. I'll skip past that. I want to thank the mentorship team who's been involved with developing this project, as well as phenomenal research staff and assistants, especially Kristen and Olivia, who have been so instrumental in getting our clinical trial up and going. And then last but not least, I always like to try and leave folks with some resources. The QR code here has a bunch of resources for local substance use treatment, as well as resources for providers with skills and strategies for talking with teens about substance use. And if anyone is interested in partnering with us and sharing this program opportunity with your patients, please reach out. We'd love to connect with you.
Great. Melissa, thank you very much.
Yeah.
Presentation. Probably want to take the slides down for now,
Oh, sure.
and then we'll continue our conversation. So I've got some follow-up questions on the presentation itself, but before we get into that, I just wanted to back up a little bit, and so our webinar participants and people that come and visit the site can learn a little bit more about you and how you got into this. So the first question I'd have for you is, what got you interested in youth pain and how to address it?
Yeah, so honestly, some of it is from my own experiences as a teenager with chronic pain and kind of navigating the treatment system, and really wanting to work with other teens and other families because resources are so limited to kind of navigate that experience. Um, and then, as part of my training as a clinical psychologist, I went to the University of New Mexico. And it was interesting after working at Boston Children's Hospital that has amazing pain management and treatment resources. I was out in New Mexico and I was seeing several teens with really severe brain injuries associated with opioid related overdoses for pain management. And it just opened my eyes to realities of pain care in other parts of our country. And that's what sparked my interest more in understanding about opioid use in the context of youth pain, and and really kind of sparked my interest more in helping teens learn other strategies and non-medication strategies for working with pain.
Great. And in your research, what's most surprised you? What kind of findings when you sort of said, "Oh, that's interesting."
I think talking with youth, it surprises me how, and in my clinical work too, how open youth are to talking about substance use. I think teens get kind of a bad rep for hiding their behaviors and things. And actually, like, when we ask the questions and when we open the door, a lot of teens are pretty receptive to resources and pretty receptive to talking about it. And so I think that's encouraging to me, that there's a lot of space for us to help them make change. The other thing I would say that just surprises me is how it surprises me that folks are always so surprised that youth have chronic pain. It's about 1 in 5 youth actually have some kind of chronic pain condition, whether it's migraines, abdominal pain, leg pain. So it's really prevalent in youth like it is in adults.
So you mentioned parents and young adults and teenagers, understandably, um, kind of want privacy and some distance from their parents. That's the kind of age where you start to separate and develop your own identity and want to stand on your own 2 feet. But what can parents do to help to help their teenager and young adult, particularly their teenagers, navigate serious pain or chronic pain? How can they be of most assistance?
Yeah, totally. So it's so tricky, and I think parent involvement and family involvement is so key in treatment. I think parents getting their own support, and learning skills and strategies for talking with their teen, doing a lot of listening, bringing and modeling and accepting attitude, which sounds kind of counterintuitive, right? As a parent, is with acute pain, you can give a medicine or give a cold pack and it gets better. But when pain is chronic, those strategies don't work. And I think that leaves a lot of parents feeling like they're failing or like they're doing something wrong. Um, and really, a lot of it is we don't understand in the medical field why some kids have chronic pain and others don't. And so I think parents can have such a role of modeling that, like, hey, we can go to school, we can have fun activities, we can live our life, and pain is there. And they can be compassionate and supportive, but you don't need to stop life because pain is there. And parents modeling that and helping their kids to stay engaged in valued activities and see their friends and live as normal of a life as possible is like such a big thing. And I think parents encouraging that sends a message of confidence that their kid can do it and that, we can conquer this, we can navigate this pain together.
Interesting. That sounds like great advice. In terms of effective non-opioid pain treatment strategies, for want of a better way to say it, we found in the research we've looked at least in terms of wisdom teeth extraction, but generally that combinations of, at least in terms of acute pain, aspirin, Tylenol, and ibuprofen work. Actually, there's a new study at Rutgers says it works even better than
Yeah.
opioids. But what are some other pretty good for people who have teenagers who used to have more long-term chronic pain, as what you went through when you were a teenager? What are some sort of innovative, new, if not innovative, new, tested good strategies and treatments for dealing with more long-term pain?
Yeah, so the gold standard of treatment for pediatric chronic pain is interdisciplinary care. So having a medical provider on board, a behavioral health psychologist, and then occupational therapist or physical therapist. And that's because we know pain is it's a mind-body experience, right? There's the physical aspect of pain, and then there's the mind-mental aspect of our thoughts, our emotions, the stress, the challenge just of your body being in pain all the time, whether it's chicken and egg, which came first. And so what we know is kind of taking that multidisciplinary approach where we're working with a physical therapist to learn ways and build confidence to move your body and also address, strengths deficits and things like that. And then along with a psychologist to help you learn skills for managing the worries about pain, processing some of the feelings that have come up. And then also having a medical provider around if there are medications that are indicated or treatments that are indicated. There are interdisciplinary pain rehab programs that are in like a day hospital model where kids go every day from like 8 to 4. It kind of models like a school day, and they're doing intensive PT, OT, group therapy. And for kids that are really debilitated by pain, like not able to go to school, not able to leave their house, that is really the best care that we have. Um, you can also piece together that kind of care on an outpatient basis, which is like what I do at Hasbro, working with the physical therapist and the occupational therapist there.
Is there adequate health insurance coverage for this kind of sounds like robust, tested and comprehensive approach?
It's definitely gotten better. Yeah. On an outpatient basis, it's pretty much often covered. And the day hospital programs, I can't speak to that specifically, but I know that a number of the programs have advocated and now do take like Medicaid and other kinds of insurances as well. I think the larger barrier is limited access to those programs. There's probably about a dozen of them in our country. And so just geographically, it's not always feasible for families to get there. And then logistically, like to go weeks on end and every day and get your kid there back and forth with like working and other kids, other childcare, whatever, it can be hard.
So, as a society, um, what if you had to name two or three things we could all do together collectively, maybe through government, but however we would need to do it to improve the treatment of youth pain and also to limit, these are sort of two separate things, but I think they may go together, limit the inappropriate use of
Mhm.
opioids, limit the cases of opioid use disorder. So you could take those in either order, or if they're the same thing, mush them together, however you want to answer that.
Yeah. Yeah. So I think in regards to like what we can do as a society, I think we need to listen and believe kids when they have pain. That sounds really simple, but the number of kids and teens that I work with who have seen many providers who dismiss their pain and then parents get to the point where they feel like angry mama bear to try and advocate because no one's listening. So I think like listening to kids, believing their pain, responding to their pain, validating their experience. Validating their pain and listening to their pain doesn't mean we have to throw a bunch of pills at it and make it go away. But I think we can acknowledge that it's there and help them to get some support through PT and through psychology to manage some of the emotions and experience of that. The other piece is I wish I don't know how this would happen, but I wish more providers understood and knew more about children's pain to be able to screen for it, to look for it. I think that's a larger issue and gap in training, honestly. Um, and then in regards to opioid use, it's again, I think some of it is provider training, and some of it is also having access to other non-opioid treatment strategies. I think if there were more pain psychologists and mental health providers that were easier for physicians and providers to refer to, and physical therapists and things like that, I think that could make it easier.
Interesting. Yeah, there's a couple points you touched on that we've been working on. One is safe prescribing continuing medical education, which is becoming more prevalent. Sounds like that there might need to be a component of that that's youth oriented. Because I don't,
Yeah,
to sort of flesh that out on the both for people in med schools, maybe clinical psychologists, but also when people get out in practice, so they get whatever the latest research and the most cutting edge information, so they can treat their patients the best. And then, as with so many other things, it comes down to, I think, primary. It sounds like you're saying it comes down in part to primary care providers need to at least know where to direct people, and that's an education process as well. And then the third thing I think you touched on is access, more primary care providers. But the third thing that at least we find is an issue, and it's good to know that on the comprehensive level for chronic pain, there's better insurance coverage. But for the sort of intermediate cases where you need physical therapy and other non-opioid effective pain treatments, they're not covered at the same level. And
yeah.
so that's one thing, we're attempting to address is parity for effective non-opioid pain treatment. So we went through a lot of stuff. Your presentation was great. Any other thing that we missed that you'd like to sort of conclude with?
Well, I think yeah, I think to the point you were saying around like provider training and pediatric specific training, I think an unintended consequence with kind of curbing opioid prescribing, which is amazing, is there's under treatment of children's pain. And historically, children's pain has been undertreated for a long time. I mean, in the 80s, they were still doing surgery on kids without anesthesia, which is wild. And I think clinically, I have noticed parents fear around giving their kids opioids and giving their kids pain medication sometimes when it's like really indicated after like major surgeries or things like that. And so I agree with you totally that some of that more nuanced education to help pediatric providers feel more secure and confident in their practices, and also to help parents understand that yes, sometimes opioids are warranted. Here's how we can use them really safely, and here's how we dispose of them, and get rid of them safely afterwards.
Yeah, just
Because
I'm
I
sorry.
was just going to say, under treating children's pain also can have long-term consequences for potential development of persistent pain later on in childhood and adulthood.
Yeah, and I think one other interesting point you raise is under treatment could also lead to abuse of substances because people are
Yes.
self-medicating the pain. Where we may have a slight difference of emphasis, I don't think a fundamental disagreement, is that research shows that doesn't mean there's no ever a case where you don't use opioids, because there are some cases you probably do. To even on surgeries, they're getting better. Assuming you have I think the point you're making about undertreating pain is important. I think
Yeah.
there's a way to robustly treat pain in most cases, not every case, and this is be up to the practitioner, without opioids. And interesting thing going on now too is there's a couple of Vortex you're probably familiar with. There's two or three new non-opioid prescription medications
Yeah.
coming on the market, which at least the testings, you know, sometimes where it meets the road in real life, it doesn't work out like the clinical tests, but the clinical tests are robust. So again, if we can get those covered at the same level, that's another
Yeah.
option that for treatment of youth and everybody else. Um,
Yeah.
really appreciate this presentation. We're going to put not only the webinar up, but if with your permission, your slides separately, if people want to also just go through those as opposed to view the webinar. They'll both be up on our website at ctpod.org with all our other webinars, and we do look forward to hearing more. We're going to have you back in a year or so, hearing more about your
Awesome.
ongoing research, which is making a significant contribution to the treatment of pain for youth, not just here in Rhode Island where we're based, but around the country. So again, appreciate your time and thank everybody for who has joined for viewing the webinar.
Thank you so much, Rob. Appreciate it.